Humeral ulnar joint. So this is a modified hinge joint that deals with flexion and extension. Radial joint, modified hinge joint that allows for pronation and supination as well as the radius rotates on the capitulum. But it can also allow flexion extension, despite the fact that that's more of a gliding motion and not quite the anchored motion that you have, or the surrounding that you have with the trochlear notch around the trochlea of the humerus. And then we have the proximal and distal radial ulnar joints. Convex radial head on the concave radial notch of the ulna for the proximal. The distal has an articular disc between them. Those joints have 1 degree of motion for pronation and supination. So during pronation, radius crosses over the ulna. Radius rotates within the radial notch of the ulna of the proximal. And the disc and the ulnar notch of the radius sweep across the ulna distally. Bursa. There's a few back here. The most common ones that you'll find are this olecranon bursa back here, which sits underneath what tendon? Up and around what tendon?
Triceps.
Triceps. So this is the posterior side, that's your olecranons. This is the back of the elbow. And you've got subtendinous, intratendinous, and subcutaneous. So that's under the skin. That's within the tendon sheaths of the 3 muscles as they come in together and form their tendons. And then subtendinous keeps the pressure off of the bone. This is a common site for rupturing a bursa. It looks huge and deformed. It looks gross, like the size of a softball coming off the end of the elbow. It's typically not very painful outside of being a deep contusion, and then within a day it'll reduce itself. So it looks very deformed, but for the most part it's, I'd say, cosmetic. It'll settle down fairly easy. It will stay tender though. We have a subcutaneous bursa of the medial epicondyle, subcutaneous bursa of the lateral epicondyle, bursa of the anconeus, and extensor carpi radialis brevis. What we're going to see, we'll get the ligaments, we'll get the muscles in a second. Okay, so ligaments provide a lot of stability with the elbow, more so than a shoulder. We have 5 to be concerned with. UCL, LCL, ALCL, RCL, annular ligament. UCL is the one you'll hear the most about. Anybody's heard of the Tommy John surgery? It's a UCL sprain, ulnar collateral ligament sprain, so it's on the medial side of the elbow. So you take somebody who throws a lot of curveballs and they crank it, and that puts that stress right in the elbow joint and it opens it up. It puts a constant stress to stretch out that ligament just by the mechanics of throwing, just by the cancer patient.
I have a Tommy John syndrome.
They go and take they take the palmaris longest out of the left arm, and they go and weave yourself a new ligament in the right elbow to create a new UCL. It was named after Tommy John, who was a professional baseball player they tried on first, and now they've got kids as young as 11 and 12 getting that surgery. It's a gross mismanagement of a child's throwing. So, medial aspect of elbow. UCL is made up of 3 parts: anterior, posterior, and transverse. The anterior part is the only part you can palpate. Everything else is deep. You can think of it a lot like the MCL of the knee. So it's preventing that stretch, that opening up from the outside. Posterior oblique, only taught when the elbow is flexed over 60 degrees. And the transverse causes no stress, rarely is hurt. The transverse, I'll show you the picture. It runs right in through here, so it more or less just kind of deepens the socket and makes sure that the posterior has a strong anchor point. But this one here is the one you can palpate easy. It's the anterior cord-like band. And we will in lab, for sure. That gets deep, and that is deep as well. The muscles cover those up, so you can't really get to those. Lateral aspects, you have the LCL or UCL, the lateral collateral ligament, also known as the lateral ulnar collateral ligament. And you've also got the radial collateral ligament. So on this side, your LCL, again, a fan shape just like your posterior band back here. So nice broad ligaments is fan shape. Protects from a varus stress, which is a hit from the inside to open it up. And then we have the radial collateral ligament. Well, we get the annular ligament, is what I'm thinking, which tethers the head of the radius in place. So the annular means ring, so it rings around the neck, the head of the radius bone, so it can rotate and pivot. There's something called nursemaid's arm. So you take a child, and you're walking with a child, and like the kid's like, "Yeah, I have mommy and daddy," and so they grab each hand. And so you can swing your kid pretty easily. I mean, kids are what, 40 pounds? It's light, so it's easy. So mom's on one side, dad's on the other, and you're kind of like just swinging the kid back and forth. It's really easy to dislocate the radius that way. And when you start getting injuries like dislocated bones, you start having hospitals start calling child protection, CPS. The resolution actually is real simple, because if you just take somebody's hand, like you're going to shake it, and you just twist it up and in, it'll reset and pop it back in without any pain. The pain goes away for the child, and everything's better. So it's really kind of traumatizing. It's like, oh my God, I just dislocated my child's elbow. But as far as just popping a radial head out, it'll slide back in. Now, I'm still going to get it checked by an ortho, but my first stop would probably not be the ER, seeing as how that's going to get CPS call. I'm not so stressed about that. So, joint capsule, radial collateral ligament. MCL on this side, there's your UCL there. That's joint capsule all through there. There's your LCL on the outside, and that makes up your annular ligament. So, really not too tough.
This is the lateral.
And that gets us into the muscles.
Annular.
So, here's the trick with the muscles.
Where's the trick?
Those three, elbow flexors. Those two, extensors. We're going to have a couple that do pronation, pronator teres and pronator quadratus. We're going to have the supinator to counterbalance those. Everything else is a flexor or extensor. So if we stop and we think about it for a minute, we need to flex the wrist. So we're going to have two muscles, one that go on each side, one on the radial side, one on the ulnar side, that are going to pull the wrist to flexion. Likewise with extension, we're going to have one on the radial, one on the ulnar, that extend the wrist. So that's four muscles right there just for wrist flexion and extension. What do you know? Those are called flexor carpi radialis, flexor carpi ulnaris. So it's referencing this fact that it flexes, it anchors on the carpal bones, and that's on the radial side, that's on the ulnar side. You come over here, extensor carpi radialis, longus, and brevis, and then extensor carpi ulnaris. So boom, we've got 5 muscles checked off in terms of identifying where they go. Then we're going to flex the digits in 2 different ways, and we're extend the digits. It's not a nightmare. Starting with the elbow flexors. Biceps brachii, brachialis, brachioradialis. Biceps brachii. That's the main one you know, your biceps muscle. Has long head and short head. Pop quiz. Where does the long head originate?
The humerus.
So long head originates on the supraglenoid tubercle, so it's above the glenohumeral joint. That's the one that goes under the subacromial arch. That's the one that if it's injured, it can actually pull the labrum off of the glenoid. You've got an inner tubercular groove right here. And there's a transverse ligament holding it down. That's the one where you get biceps tendonitis. That travels right up the medial side of the humerus. Up and underneath and deep inside the joint space.